An important decision that many healthcare organizations face is whether or not to adopt a fully integrated electronic medical record system. Both large and small healthcare facilities must decide if such a software system would be beneficial to their business. These systems can range from a single family practice to a 5-hospital system. In the past, healthcare organizations had completely separate software for separate functions such as medical charts, scheduling, and radiology. These separate functions were not integrated even within one healthcare facility. These multiple programs could not speak to each other. Clinicians were required to use these different tools when trying to care for one patient. For example, Dr. Stethoscope in Greensboro, North Carolina has a patient, Keisha Smelt, who needs brain surgery. As with most patients, Keisha has other conditions in her medical history. She was treated for cancer when she lived in Florida and is a diabetic. In order to give Keisha the best care, Dr. Stethoscope would like to see any previous radiology results and lab work. He would also like to coordinate his care with her endocrinologist in Raleigh, who helps manage her diabetes. Currently, he would have to search many different avenues to gather all of this information about Keisha. A fully integrated system would allow Dr. Stethoscope to be more efficient in caring for Keisha and every patient. He would have the information he needs in less time and be able to spend more time focused on her care plan. He would have, within one chart, an up-to-date problem list with current and active diagnosis. Productivity gains can be measured within an integrated electronic medical system by looking at patients seen per day and revenue. The application can track health system data and produce reports related to performance and outcomes. Dr. Stethoscope will improve his patient care by improving his productivity. Quality improvement is visible within an electronic medical system as it tracks the documentation that clinicians are required to keep. This system makes it easier to see if they are doing this part of their job and at the appropriate times. This documentation is important in patient care because it keeps track of any allergies and medical history. Another reason for a healthcare facility to decide to implement an electronic health record is that it improves care coordination. Dr. Stethoscope can learn about Keisha's cancer surgery in Florida. This enables clinicians to exchange key clinical information among other providers of care and patient-authorized entities. An electronic health record improves safety within healthcare by providing stops and checks to verify that the clinician has the right patient, the right procedure, at the right time. Nurse Nan must scan patient Keisha's barcode before scanning her medication, before administering her medication. Keisha's daughter lives in California and would like to understand her mother's healthcare situation. Previously, she would have to wait until Dr. Stethoscope had time to talk to her on the phone. With an electronic medical record, she can use the MyChart application to actually view her mother's medical chart from her home in California. MyChart is a secure web portal that patients and family members can use to access information and communicate with the health system online. Keisha and her daughter can send Dr. Stethoscope questions and messages. Electronic health records actually ensure patient privacy of information better than paper charts. The billing application of electronic health records streamlines data entry, reduces accounts receivable, produces accurate claims, and supports paperless collections. Keisha receives one bill with all of her information. Dr. Stethoscope could use electronic medical records to access radiology results posted alongside other test results in the single chart established for Keisha. His secretary can schedule and track patient appointments across multiple sites. Outpatient office visits and hospital visits are documented within the same chart. Providers can view their own orders as well as others with the computerized provider order entry. The pharmacist receives prescriptions electronically and can monitor medicine history and check for drug-drug and drug allergy interactions. As more healthcare facilities adopt electronic health records, more data across the country can be gathered and reported, which helps to improve population and public health. Electronic data can be sent to immunization registries and public health agencies. This includes reporting clinical quality measures as well. Of course, healthcare facilities must also consider the negative aspects of adopting an electronic medical record. One is the large cost of implementing such a system. There's a sizable initial cost of purchasing the software. There is also the cost of training every employee on the new applications and the cost of slower productivity while learning the new system. It would be typical to need up to 6 months after implementation until stability. The first few weeks after go live, a hospital may need to provide on-call support for as many as 1,000 calls a day. As with any new system, there can be errors and setbacks at the go live which have to be worked out. A hospital system may implement their new integrated medical records in several different go live timeframes spread out over a year. This would allow more time to solve problems individually while starting one section at a time. By deciding to implement an electronic health record, healthcare facilities are able to comply with the meaningful use requirements set by the Health Information Technology for Economic and Clinical Health Act. Meeting these standards allows healthcare facilities to receive financial incentives for using electronic health record. In conclusion, hospital systems may decide to implement a fully integrated electronic medical record for several reasons, including improving their patient care and increasing their productivity and safety. The real-life result is that Dr. Stethoscope and Nurse Nan are able to do their jobs more effectively, and patient Keisha receives coordinated, appropriate care.